Neuroendocrine complex regional syndrome, also called complex regional syndrome, also called acute sympathetic or sympathetic dystrophy. So, in complex regional syndrome is a patient that usually has a traumatic event, so a trauma or a crush to the limb or something like that, and then would present with allodynia. This is the painful sensation of a non-painful stimulus, or the patient would have a severe excruciating pain on the limb, but it is unrelated to nerve injury. The pain usually occurs 4 to 6 weeks later, but it could appear at any time. Additionally, the patient would have sympathetic dysfunction, and the sympathetic dysfunction leads to changes on the blood flow. Could be increased or decreased. If it is increased, there would be warming of the extremity, and it would look like erythematous. If it is decreased, it would look cyanotic and with coldness. There could be increased or decreased hair growth and nail growth. There would be dysfunction of the limb. This is due to inflammatory cytokines being released. And this is a dystrophy. It is subdivided into 3 phases: the acute or traumatic, the dystrophic phase, this one, and then the atrophic phase. The treatment is usually NSAIDs. NSAIDs would be the first treatment, and emphasizing the exercise and physical therapy. Then we could give, if this doesn't work, we can give tricyclic antidepressant drug, or pregabalin, gabapentin, or calcium channel blockers. This is treated as the same as the peripheral neuropathy. And lastly, if this doesn't work, we can do a sympathetic block, and only on the severe cases there would be need to refer to a specialist on pain. So this is regional complex or complex regional syndrome, acute sympathetic dystrophy. This is the acute severe pain after a traumatic injury that is associated with sympathetic changes like the coldness and cyanosis or warmth and erythema.